As a doctor, I'm shocked. This sleeping position triggers reflux overnight. Are you tired of waking up with that burning sensation in your chest? What if I told you that the way you're sleeping might be making your reflux worse every single night? In this eye-opening video, I'll reveal a shocking truth about how a common sleeping position could be triggering your acid reflux while you rest. By watching until the end, you'll discover not only which positions to avoid, but also the doctor-recommended sleeping arrangements that could give you relief starting tonight. This simple change could transform your sleep quality and reduce those painful symptoms you've been struggling with for years. Don't miss the special technique I'll share at the 15-minute mark that my patients call a game changer for nighttime reflux relief. Ready to finally get the restful, reflux-free sleep you deserve? Let's dive in. Hello there, and welcome back to the channel where we talk about real solutions for acid reflux and digestive health. Today, I'm addressing something I see in my practice almost every day: patients struggling with nighttime reflux who have no idea their sleeping position is making everything worse. Have you ever wondered why your reflux symptoms seem to be at their worst first thing in the morning? Or why that burning sensation sometimes wakes you up in the middle of the night? The truth about reflux is that it doesn't just happen randomly. There are specific triggers, and one of the biggest ones might be surprising you every night without you even realizing it. I've spent years working with reflux patients, and I've noticed a pattern that many doctors aren't talking about enough. Let me ask you this: do you sleep flat on your back? Or maybe you're a right-side sleeper. If you answered yes to either of these questions, you might have just identified why your reflux symptoms persist despite medication and dietary changes. Are you surprised? Most of my patients are when I tell them this. The science behind this is fascinating. When you lie flat, especially on your back or right side, you're essentially working against gravity. Your stomach is positioned in a way that makes it easier for acid to flow back up into your esophagus. Think about it. Have you noticed that your symptoms get worse when you lie down shortly after eating? That's not a coincidence. What happens in your body during sleep is critical for understanding reflux. Your digestive system doesn't shut down when you sleep. It continues processing whatever you ate before bed. If you've eaten a heavy meal or consumed trigger foods like tomatoes, chocolate, or citrus, your stomach is producing extra acid to break these down. When you add a poor sleeping position to this mix, you're creating the perfect storm for acid reflux. I remember working with a patient named Margaret. She's given me permission to share her story. Margaret had been suffering from severe reflux for over a decade. She was taking prescription medications, had made significant dietary changes, and even elevated the head of her bed as many doctors suggest. But she was still waking up with that terrible burning sensation and the bitter taste of acid in her mouth. When I asked about her sleeping position, she told me she always slept on her right side because it felt most comfortable for her. Hip pain. This was a crucial piece of information. After explaining the connection between right side sleeping and reflux, we worked on transitioning her to left side sleeping. Would you believe that within just 2 weeks, her nighttime reflux symptoms had improved by nearly 70%? She was amazed that such a simple change could make such a dramatic difference. But why is sleeping on your left side so much better? It all comes down to anatomy. Your stomach has a natural curve, and when you lie on your left side, the junction between your stomach and esophagus is positioned above the level of stomach acid. This makes it much harder for acid to backflow. On the right side, it's the opposite. You're essentially creating a direct path for acid to travel up into your esophagus. Have you ever noticed that you feel better when sleeping on your left side? Or maybe you've never paid attention to this connection before. I'd love to know your experience in the comments below. Now, I know what some of you might be thinking, but doctor, I've always slept on my right side. I can't possibly change my sleeping habits at my age. I hear this concern frequently, especially from my patients who are in their 50s, 60s, and 70s. And I want to assure you, you absolutely can make this change, and it gets easier with time and the right approach. Here's what I recommend to my patients who are struggling to adapt to left side sleeping. First, try using a body pillow that runs along your back to prevent you from rolling over in your sleep. Have you ever tried using a body pillow this way? Many of my patients find this simple trick incredibly helpful. Second, consider placing a small pillow between your knees when sleeping on your left side. This helps align your spine properly and can prevent hip and lower back discomfort that might otherwise tempt you to roll onto your right side or back during the night. Is back or hip pain preventing you from staying on your left side throughout the night? Third, and this is crucial, don't try to make this change immediately after a large meal. Your body will naturally seek the position that feels most comfortable when your stomach is full, which might override your conscious efforts. Have you noticed how your body seems to decide which position feels best after eating? Let me ask you something important. Are you elevating the head of your bed? If not, this is another critical change you should make alongside adjusting your sleeping position. When you elevate the head of your bed by 6 to 8 inches, you're using gravity to help keep stomach acid where it belongs. This isn't the same as using extra pillows, which can actually make reflux worse by creating pressure on your abdomen. The most effective way to elevate your bed is to use bed risers under the headboard legs or to place a wedge under your mattress. Have you tried either of these methods? They can make a tremendous difference in combination with left side sleeping. Now, let's talk about another factor that might be sabotaging your sleep without you realizing it: your evening routine. What do you typically do in the 3 hours before bedtime? Do you enjoy a late dinner, perhaps a little dessert or a nightcap? Maybe you take medications that could be affecting your digestion. These habits can dramatically impact your reflux symptoms regardless of your sleeping position. Ideally, you should finish your last meal at least 3 hours before lying down. This gives your stomach time to empty, reducing the amount of acid present when you go to bed. Is this something you're currently doing, or would this require a significant change to your routine? I had a patient named Robert who was doing everything right. He was sleeping on his left side, had elevated his bed, and was taking his medications as prescribed, but he was still experiencing nighttime reflux. When we dug deeper into his evening routine, we discovered he was having a small glass of wine with dinner each night. Even though it was just one glass, and even though he was having it with food, that wine was triggering excess acid production that lasted well into the night. When Robert eliminated the wine, his symptoms improved dramatically. This highlights an important point. Sometimes it's not just one thing causing your reflux, but a combination of factors. Are there any foods or beverages you consume regularly that might be contributing to your symptoms? Speaking of medications, let's discuss how certain common drugs can affect reflux, especially when combined with poor sleeping positions. Are you currently taking NSAIDs like ibuprofen or aspirin? These medications can irritate your stomach lining and make reflux symptoms worse. The same goes for certain blood pressure medications, particularly calcium channel blockers. If you're taking these medications and struggling with reflux, I'm not suggesting you stop them. Please never discontinue any prescription without consulting your doctor. But it might be worth discussing alternatives with your healthcare provider, especially if you're making other changes like adjusting your sleeping position without seeing improvement. Now, I want to share something that many of my patients find surprising. Did you know that stress and anxiety can significantly worsen reflux symptoms? It's true. When you're stressed, your body produces more stomach acid and slows down digestion. This creates the perfect conditions for acid reflux, regardless of how you're sleeping. Have you noticed that your reflux symptoms get worse during stressful periods in your life? This is something worth paying attention to. Incorporating relaxation techniques into your bedtime routine can make a tremendous difference. Simple practices like deep breathing, gentle stretching, or meditation can help reduce stress and prepare your body for restful, reflux-free sleep. I recommend trying this simple breathing exercise before bed. Breathe in slowly through your nose for a count of 4, hold for a count of 7, and exhale through your mouth for a count of 8. Repeat this for times before lying down. Have you ever tried breathing exercises specifically for digestive health? Let's talk about another critical factor that many people overlook: your sleeping environment. The type of mattress you use, the pillows you select, and even the pajamas you wear can all impact your reflux symptoms. Is your mattress supportive enough to maintain proper alignment with sleeping on your left side? Do your pajamas have tight waistbands that could be putting pressure on your abdomen? These might seem like minor details, but they can make a significant difference in your comfort and symptom management. I recommend loose-fitting, comfortable sleepwear and a mattress that provides adequate support while allowing your body to maintain proper alignment. Now, I promise to share a special technique at the 15-minute mark that many of my patients call a game changer for nighttime reflux. Here it is, the 3-to-1 method. This simple approach has helped countless patients in my practice achieve better sleep with fewer reflux symptoms. The 3-to-1 method works like this: stop eating 3 hours before bed. Stop drinking except for small sips of water 2 hours before bed, and spend the last 1 hour before bed in a calming, screen-free environment. When you combine this routine with left-side sleeping in an elevated bed, you're creating optimal conditions for reflux-free sleep. Have you ever tried a structured evening routine specifically designed to reduce reflux symptoms? Many of my patients are surprised by how effective this simple approach can be. The key is consistency. These habits need to become part of your daily life, not just something you try occasionally. I want to emphasize something important here. Making these changes doesn't mean you'll never be able to enjoy your favorite foods or have the occasional late dinner. Life happens, and rigid restrictions often lead to frustration and abandonment of healthy habits. The goal is to establish a routine that works for you most of the time, while giving yourself grace for the exceptions. Another question I frequently get from patients is about morning reflux symptoms. Have you ever woken up feeling fine, only to experience burning or discomfort shortly after getting out of bed? This is actually quite common and often relates to how quickly you transition from lying down to standing up. When you've been lying down all night, even in the optimal position, your digestive system has adjusted to that horizontal orientation. Jumping up quickly can trigger a rush of acid. I recommend sitting on the edge of the bed for a minute before standing, and then standing for another minute before walking around. This gradual transition gives your body time to adjust and can prevent that morning reflux surge. Have you noticed this happening to you? Let's also discuss the importance of what you eat first thing in the morning. Many people reach for coffee as soon as they wake up, but this can be particularly problematic for reflux sufferers. Coffee is acidic and stimulates additional acid production, a double challenge for your digestive system first thing in the morning. Instead, try starting your day with a small, alkaline breakfast like oatmeal with banana or whole grain toast with a little almond butter. Have you considered how your breakfast choices might be affecting your reflux symptoms throughout the day? I want to circle back to sleeping positions for a moment, because there's an important nuance I haven't mentioned yet. While left-side sleeping is generally best for reflux, the specific position of your head and neck matters too. Are you using too many pillows? This can create an unnatural bend in your neck and actually increase pressure on your stomach, potentially worsening reflux. The ideal setup is a single, supportive pillow that keeps your head aligned with your spine when sleeping on your left side. Some specialty pillows are designed specifically for side sleepers with reflux. They provide the right support while maintaining proper alignment. Have you explored these options? As we approach the end of our time together today, I want to address a question I hear frequently from my patients. How long will it take to see results from these changes? This is a natural question, especially if you've been suffering from reflux for years. In my experience, most patients notice improvement within a few days of consistently sleeping on their left side with an elevated bed. However, complete resolution of symptoms often takes longer, typically 2 to 4 weeks of consistent practice. The key word here is consistent. Trying left-side sleeping occasionally won't produce the results you're hoping for. Are you willing to commit to this change for at least 3 weeks to give it a fair trial? Remember Margaret, the patient I mentioned earlier? She didn't see dramatic improvement overnight. The first week, she noticed modest changes, fewer middle of the night awakenings with burning discomfort. By week 2, she was sleeping through the night more consistently. And by week 3, she was waking up without that bitter taste in her mouth for the first time in years. Your journey might look different, but patience and consistency are essential companions on the path to better digestive health. Have you found it difficult to maintain consistency with health changes in the past? What strategies have helped you stick with new habits? Before we wrap up, I want to emphasize something important. While sleeping position can make a tremendous difference in managing reflux symptoms, it's not a substitute for appropriate medical care. If you're experiencing severe or persistent reflux symptoms, please consult with your healthcare provider. Chronic acid reflux can lead to complications like Barrett's esophagus or even esophageal cancer if left untreated. That said, the changes we've discussed today can complement medical treatment and potentially reduce your reliance on medications over time. Many of my patients find they need lower doses of their reflux medications after implementing these lifestyle changes consistently. Have you discussed lifestyle modifications with your doctor as part of your reflux treatment plan? So, to summarize what we've covered today, sleeping on your left side can significantly reduce nighttime reflux symptoms because of the way it positions your stomach and esophagus. Elevating the head of your bed provides additional protection by using gravity to keep acid where it belongs. Combining these approaches with mindful evening routines, stress management, and appropriate breakfast choices creates a comprehensive strategy for managing reflux. If you've stayed with me until this point, thank you for your attention and commitment to improving your health. This tells me you're serious about finding solutions for your reflux symptoms, and I believe the approaches we've discussed today can make a real difference in your quality of life. I'd love to hear about your experiences with different sleeping positions and reflux. Has sleeping on your left side helped you? What other strategies have you found effective? Please share your thoughts in the comments below. Type left side. If you're going to try this approach starting tonight, your experiences might help someone else who's struggling with similar symptoms. If you found this information valuable, please give this video a thumbs up so others with reflux can discover these techniques. And if you haven't already, consider subscribing to our channel for more evidence-based strategies for managing digestive health concerns. I release new videos every week addressing common questions and challenges related to acid reflux and other digestive conditions. In our next video, what should be appearing on your screen now, I'll be discussing the surprising connection between reflux and respiratory symptoms like chronic cough and asthma. Many people don't realize these conditions can be linked, and understanding this connection could be the missing piece in your treatment puzzle. Click on that video to continue your journey toward better digestive health. Thank you for joining me today, and remember, sometimes the simplest changes can make the most profound difference in your health and comfort. Here's to better sleep and fewer reflux symptoms starting tonight.